welcome to the podcast, the Faculty Tsakap. It's a pleasure.
It's our pleasure that you'll be here with us. Okay, this congress for our I forget to start here.
Just
Sorry.
Sure.
Okay, this congress is the biggest congress of Cariri. Cariri is a lot of regions of the
States,
Juazeiro do Norte, Crato, and Barbalha. Okay,
Yep.
so we have Dr. John, that he's a biggest dreamer in odontology. He always dream about a big college, and he made Secapi. And to us, being here is a pleasure, is our dream too.
No, it's my pleasure to be here.
So
And thanks a lot for the invitation to all the organizational committee and my dear friend Dr. Brianna Lins. I'm super happy.
Really?
Yeah, I'm super happy, and it's a privilege for me to be with you.
thank you
Brianne
so much.
teach with me in the faculty.
Oh, that's great. That's
yeah.
great. That's great.
Have international. I forget the word is palestrante.
The speaker.
Yeah, international speaker with us is a dream that come true, because we have a lot of good people.
Well, with really with good details. I've been participating in lots of congresses, international and the local, but this is done perfectly with really good details. Yeah, especially I love the presentation desk. The three presentations are being happening at the same time without any noise. I really enjoyed and loved it.
It's really great,
Yeah,
huh?
that's great. Yeah, that's great.
So please tell me about you, your life in odontology. We want to know about you are
The news in orthodontics, aligners.
yeah.
Yeah, okay. First of all, let's start. My connection is about Brazil, right? After the high school, I did an exchange program called AFS, and I spent 1 year in Brazil.
Really?
Oh,
Yes,
so cool.
in the city Açu, Rio Grande do Norte. I spent one of my best year in my life with the perfect host family. It was 2001, and I came back to Turkey 2002 and started my dental faculty. After the 5 years, I started my orthodontic residency. So I've been working in the orthodontic field since 18 years. And my last 12 years, I spent time with the aligner treatments. And I use lots of global and the local brands, and also lots of in-lab aligners, very local ones. And since the Clear Correct brand, since the Straumann brand Clear Correct aligners, since the Clear Correct Turkey launch to 2020, I'm just treated all my cases with the Clear Correct aligners. So I'm a global and the local speaker of Clear Correct. So I'm giving lots of speech, presentations, case studies about Clear Correct in all over the world. So it's my privilege and honor for me to speak in front of you. Thanks for the invitation, and I'm in my second home, so I cannot explain my feelings.
Thank you so
Welcome.
much. Thank you so much. You say about you have a lot of cases in your all.
The cases, techniques. I don't only give speech about just the cases. I also give speech of the biomechanics of the aligners, disadvantage and advantage, and what kind of techniques we have to choose in the aligner treatments. Do we have to go to every case with the aligners, or we can choose the
Every
fixed
case.
one? It's up to you. So sometimes the cases are challenging. So you don't need to go to every case with the aligners,
Do you
or
have
you have to know that you should use some fixed appliances in aligner treatment.
Do you have
cannot
any
use it.
complex case of
Yeah,
that
I'm gonna show them tomorrow. Yeah.
Oh, nice.
Yeah.
And about the acceptance, because here there is a financial difficulty in the aligners, especially clear align. Oh,
Yeah.
Money-
Invisalign. Sorry, Invisalign, because it's so expensive for.
Sure.
Here, money
Much
is always a problem
Yeah.
here in Brazil.
I really don't know the exact prices of the aligner treatment in Brazil, but I have lots of Brazilian colleagues that we are discussing and we are talking.
Here is very
I-
expensive.
Here.
I think it's similar to Turkey. When you compare with the Europe for United States, here and Turkey are much more cheaper, and the aligner treatment and the fixed one. What I'm doing too, I'm trying to make my fixed treatment price list and align price list a little bit close to each other. So I don't want to give a big difference for them. So I explain the journey that the patient will have with the aligner treatment and the fixed treatment, and I don't want to exaggerate the difference between the prices. So most of my patients accept the aligner treatment rather than the fixed one. And after you do a lot in your clinical practice, then you have much more references just coming to your clinic just to get aligner treatment. No discussion with the fixed treatment. But about the price, it's we can discuss for 2 days and 3 days more about this price. But I'm getting close to fixed treatment and aligner treatment price. Make it close, not a huge gap. Yeah.
Do you combine techniques to treatments?
Yeah, definitely. You cannot go with just the aligners in every case. You have to use some fixed, maybe sectional wires or buttons, elastics, or like, buttons to solve the rotations. So that we call it
I'm
the
a-
force pairs. We have to use it because if the teeth are really rotated, if the teeth are really intruded, you cannot extrude it, you cannot rotate it just with the aligners. You have to believe, you have to trust your orthodontic philosophy, orthodontic knowledge rather than the aligner.
In what aspects have aligners changed the way the orthodontics patients are treated?
Yes, I'm going to talk about this also for tomorrow. That before, especially for the lower arches, when the crowding is borderline, let's say, our education was always about deciding an extraction treatment. But when the aligner comes to our world, because they're doing the distalization very well, so we can decide the lower arch distalization in the aligner treatment. So if you distalize 2 millimeters per right side and 2 millimeters per left side, you can get 4 millimeters. And with the IPR, you can get more 2 and 3 millimeters. So for borderline cases, you can go with the non-extraction treatment. So
Mini
this
screw.
even you can use the mini screw, or even you can use the elastics or other techniques.
Yeah.
But the 2 millimeter distalization, you can do it quite well with the aligners. So before we were thinking, okay, let's extract 2 premolars for this borderline case. Now we are thinking, okay, let's distalize the lower molars and do some IPR in posterior anterior region and create a space for 7 millimeters. 7 millimeters is huge.
Yeah.
Yeah. So
That's
then we
huge.
change my mind. So we are now looking at the panoramics and decide to extract the wisdom teeth first and make expansion and make distalization for non-extraction treatment. So it's so this evolution changed orthodontists' minds. That the other teeth, other part, you can do most of the movements at the same time. So it gives a time to you. You don't need to expand first. You don't need to protrude first. You don't need to align first. You can align, extrude, rotate, expand at the same time. So you can decrease the treatment time with the aligners. Yeah.
Do you treat children?
Children?
Children's?
Yeah, mostly. In next dentition cases, I love to use aligners, and I will never try to use the conventional appliances anymore. Because with the
Which is
conventional,
better.
yeah, you know, the Schwarz appliance, you know, the acrylic appliance with the clasps, I do a lot. Rapid palatal expansion is another case.
Yeah, okay.
Yes, it's another case. But with the removable appliances, no discussion.
Do you use it? Hyrax has.
Yes,
Yeah.
I use Hyrax. I now only use the digital Hyrax. I don't take an impression anymore. The digital Hyrax I use a lot with mini screw assisted palatal expansion in, you know, after 16 and 17 years, right? But this is another indication. But for the lower arch, we cannot have so many fixed options to expand. So, you know, with the conventional acrylic appliances, we expand, then we wait for the teeth align spontaneously, then we go for another appliance, for the third one, but with the aligners you can expand, protrude, get them close each other and get space for the canines at the same time. So we decrease the treatment time. And in the mixed dentition, now the patients, the children are coming that I don't want to see anything here, so I want all transparent. Even they are 8 years old. So my first option will be the
It's
aligners.
so much better.
Yeah, you can also move the mandible forward with the aligners.
You feel better.
With the just elastic.
Yeah.
Yeah, they feel better, and their families get better because you know when when the clasps get broken, they have to come. When especially in the lower arch when you used acrylic ones, after some period of expansion, they feel that there's a impingement here. It's hurting. So you have to grind the appliance, then lots of problems they're having. But with aligners, they're not feeling, they're just feeling the pressure on the crown, right? If there's a problem with one
Change the
appliance,
aligner.
okay,
Yeah.
go to the next one.
The next.
Go to the next,
At
yeah.
best, I thought that it doesn't work for everybody. So this not work for me. I don't want to learn about this. But today I see a lot of people saying the same that you saying that you speak now about the. I see a lot of a lot of success cases. Eu tô enrolada agora. I see a lot of success case. So now I see that that's not future. Yeah,
No,
this is not
this
future.
is a recent time.
Yeah.
Now we can treat at least 90% of the all orthodontic cases with the aligners. Could be more than 90. If you convince your patient that yes, we're gonna do aligner treatment for you, but for some reasons, in some particular time of your treatment, we're gonna use some fixed wires. If
We need more.
If they accept, we can
Okay.
work with the aligner. Yeah. Even I have colleagues that he or she is gonna do a fixed treatment with the distalization. They use aligner for distalization first, and they continue with the fixed treatment instead of using mini screws. There's another
Mixed
technique.
techniques.
Yeah, mixed techniques. Yeah. Yeah.
How can you monitor the progress into the case?
It depends how I plan the case. It depends how the case is complex or moderate.
Tomography?
Yeah. If the case is easy, you can do all the IPR and the plan before the start of the treatment, and you can give all the aligners to the patient. And you
Faster.
can say, okay, come to my clinic 6 months later. But if the case is moderate or complex, it's better to see the patients once let's say 10 weeks or once in 8 weeks. It's better, even it's an aligner treatment. It's good to monitorize the patient. You know, every patient is not the same. Sometimes they're losing their cooperation, so it's better to
We
see
have the
in the
good
right
patients
time
and we have the bad patients.
and get an action.
The cooperation is a problem because the brace is fixed, the aligner not.
Yes, but according to my experience, even the family say that no, we
That's
cannot
not a problem.
we cannot trust our children. These children are really trustable. when we start the
Really?
when we start their treatment,
Ah.
they're very disciplined.
Ah,
yeah,
so good.
yeah, they're very disciplined. Yeah, I believe in children. They're better than the adolescents.
I'm a mom right now, so my child, it's very smart. Sometimes I see her doing something that I look and ask for myself. Really? And
Yeah.
she just had 1 month. She just had 1 month. She can stay up her
Her
head and stay. And what?
It-
Really? You just have 1 month?
Yeah, this is
I believe child too.
this is called epigenetical factors.
How can young orthodontics prepare for this new reality, the aligners?
What do you mean?
The younger generation,
Yeah.
the people that out of the college right now.
It's the aligner treatment. Yeah, we love the aligner treatment, but it's a little bit risky. Why risky? Especially this regeneration. They want to learn the aligner treatment as soon as possible without learning the basic philosophy of the orthodontics. Unfortunately,
And they-
first they have to learn the biological and biomechanics of the orthodont treatment first.
They want it
Then
so fast.
They then after that they can jump into the aligners. They know how to put the braces. They know how to treat the patient with the braces first. Then it's better to jump on the aligner treatment because the aligner treatment technique and the fixed treatment techniques are very different.
You have to do
Yeah,
all
yeah,
steps
yeah.
right.
Yeah.
So first the basics of orthodontics, then
The
the
problem
aligners.
in the aligners because all the professionals think what to do. But
Think that easy.
yeah,
Oh, that's so easy. I can do
yeah.
it too.
Yes,
But-
most of our colleagues are thinking
It's not
that
the way, no?
we're sending our records and the treatment setup will come. Oh, the teeth are aligned well. Okay, let's approve the first treatment setup, but it's not going as it.
Yeah.
So you have to see, you have to think about the friction. You have to
Diagnose.
sequence the movements. You cannot do everything in the same time. You should take an anchorage from group of teeth to move the other groups. So it's another knowledge. So without this knowledge, it's gonna be a disaster. The aligner treatment, unfortunately, is yes, the people, the colleagues, the doctors thinking that okay, and then the treatment setup digitally, the teeth are aligned very well. Okay, let's approve the first setup, but it always fails.
I work with endodontics. In endodontics, we see the same.
Yeah.
A lot of people don't want to make the step by step, and it's a disaster.
Yeah. Regardless of the material, regardless of the company, regardless of the software what they're using, if you do a wrong plan, it never works with the aligners. Because it's a closed system, not as a fixed one.
Do you
And-
use it unique system or
Excuse me?
in the aligners?
Yep.
Unique, the only system,
The only session?
sim, in aligners?
My session tomorrow?
No, not my session. Your session. Do you use just one of way of treatment?
No. I definitely choose a different kinds of treatment and different kind of indications. Right. And different kind of attachments we're using in terms of different kind of movements. So aligner to the most important thing with the aligners is to produce a really good treatment setup because with the setup they're gonna manufacture and produce your aligners. So main important part is to produce a good treatment setup. But I'm not doing this always the same with every cases, right? Sometimes
You have a
I
lot
do
of
distalization,
different
sometimes
cases.
I choose the extract and I close the extraction side with the aligners. So it's a general knowledge of orthodontics. It doesn't change. So I do lots of TPS, treatment planning services for other doctors when they are planning their align treatments. I help them, I support them. So first, I ask to them, what's your treatment plan, regardless of aligner, regardless of fixed braces. What's your treatment? What we're gonna do?
The line is just the way,
tell
yeah.
me. Okay, are you gonna make distalization? Are you gonna extract teeth? Are you gonna expand? Or are you gonna do IPR? What's your plan? Tell me, and then let's discuss. We can do it with the aligner or not. Or did you talk to your patient about extraction of wisdom teeth before you decide to do a distalization?
What do you want?
Best
So?
just give me your treatment plan, then we will discuss. Without a treatment plan,
The possibilities.
without a treatment plan,
I can
we
show you
cannot
all.
say with the align. Let's try this movement. No, let's try this plan. Let's see if it will work or not. No, it's
Yeah.
not an aligner.
The diagnostic is the base.
If you're an orthodontist, make a treatment plan first. I always say to you, okay, what were you doing in your residency program? You were making a presentation to your professors about each case, right? This is the diagnosis, and this is my treatment plan. Okay, do it the same to me for your aligner treatment. Then we will discuss the movements first.
What the duration the residence program in Turkey, the orthodontic?
Yeah,
The
I think it's the same. We have PhD programs and we also have the
years?
master programs.
Here is 3 years.
3 years here.
In Turkey, the master programs, let's say the residency, at least 4 years.
Ah,
Yeah, we also have the PhD programs. Could be similar in some ways. They are at least 6 years.
Like with the PhD.
Yeah,
PhD.
so I did PhD in orthodontics, right? So that's mine was 7 years.
I am orthodontics, but not PhD in orthodontic, just in odontology, in dentistry.
I think the system is a little bit different in Turkey. I checked lots of systems in United States, in Europe, and in Brazil. It's a little bit different. Our programs last more because we attend so many patients. Yeah, so the master programs last at least 4 years. The PhD program at least 6 years.
Here, the master program is 2 years, is the PhD 4 years.
Okay.
The residence is 3 years.
3 years. Yes, but you know, when we start the PhD, we do thesis in a particular subject, but also we attend patients, at least 200 patients. So you cannot treat 200 patients in 2 or 3 years. Yeah.
Oh my gosh, 200.
but I think that's better because
Ah.
you do a lot.
If you
Yeah.
see more,
Yeah, you see more, you
and
do a lot.
you only don't treat your patients. You also see your colleagues' patients or the doctors
learn
above
more.
you.
In
You know.
in my residence program, I think I attend 20 patients.
20 patients in the first 3 months for us.
Okay.
Yeah.
Okay.
Okay, 200, my gosh.
So we graduate with really good experience when we have our master degree, right?
I think it's better this way. It's so
Let me
much
know
better. It's so much better.
It's another subject that we have to discuss later. Yeah. Is it good or not? Yeah,
Let's
if you
not-
attend too many patients, you feel yourself much more confident
Oh my
about
gosh,
because
I'm
you
impressed.
see, yes, you see lots of indications, thousands of
In the
indications.
final, you is better. It's so much better because you
Yeah.
see a lot, you do a lot.
Yeah,
No doubt.
lots of orthodontic surgery patients, lots of cleft palate patients, lots of distalization, extraction treatment, right? And
I
now in the universities, they're being educated by the aligner treatments. Also, they have to finish, for example, just 20 cases with the aligners. This is just for the aligners.
My gosh.
So you have another.
Do you have a message for
Another
the?
question, sir?
No. Do you have a message for the students?
Oh, that's
To the future, to the orthodontics.
to
Okay.
us.
Sure. Now, as you see, we're in the digital world, and our diagnostic tools have been improving so much. You know, when the technology improves, it first affects the medicine and the dental field. So we have everything to diagnose the patients. So I can recommend to the young dentists that please use all the tools, not just look at just one diagnostic tool.
Yeah.
So it will help you to think in different way. right? CBCT, digital panoramics, and MRI, so and intraoral scanners. That even I do a fixed treatment with my patient. I scan my patient that I can diagnose a 3D.
My husband worked with it.
Yeah.
With scan, digital, odontology.
And you can
The future.
you can share
not the
you
future.
can share
the,
your case.
The now.
Right now,
You can
present,
share your
present,
case
present.
with
Yeah.
your colleagues
Yeah.
in 1 minute, but with the just with the photographs and the cast, you cannot share.
It's not the same.
It's not the same.
He made
no.
a lot of surgeries
Yeah,
with
sure.
digital. It's
Yeah.
so much better.
Yeah,
We
3D
have
3D surgical
Yeah.
softwares, right? They're very precise. They're very precise. So it's good for the patients. You know, 10 or
comfort
10 or
zone.
20 years ago, we were doing this surgery disciplines from the cast with handmade. So when the surgery starts, the splint is not fitting, so the surgery stops. Lots of problems. But when everything is produced digitally and diagnosed and produced digitally, very precise, no problem. So it's good for doctor and for the patient.
Yeah.
we have
No doubt.
we have the patients before the surgery in our notebook, so
Yeah.
we can do it before.
Yep.
And when I make the surgery, it's so much better,
Yep.
so much safer.
Yeah, but about the softwares, especially the soft tissue profile is not matching with the real world. Just that, yes. The skeletal part, yes. When you move, for example, 8 millimeters, it will go 8 millimeters. But how it will affect the
Sometimes we
facial,
have-
yes, the soft tissue profile, the patients are asking about this, so I always try to escape to show how the soft tissue profile change after surgery, because it's not a 100% correct. Still, with the software and the real one, just we can show the bite, occlusion, we can show how we can correct their asymmetry, right? But it's better not to talk about the soft tissue profile so much, because it's not still the real world, how it's affecting. Yeah.
Do you have another question?
No.
Just thank you so much.
You're welcome.
Thank you so
Thank
much.
you so much.
Today we are not prepared for this, but
It's better. It's better. Spontaneously.
but for me is pleasure, and
For me too.
I just wanted to say thank you so much.
Yeah.
You're welcome.
Thank you.
Thank you so much.
And
Do you forgot what you said? She forgot what you said. Enjoy Kariri.
I will try. I will try. Thank you so much.
Thank you so much.
Have a perfect day.
fugiu a palavra.